Hi, my name is Tanisha Irvin, and I am a pharmacist. If you have not heard of a pharmacist before, don't worry, I've got you covered. Think of pharmacists as healthcare's trusted medicine and vaccine experts. Many people recognize us from being in your local pharmacies like Walgreens or CVS, or even in your neighborhood grocery store. We are there providing medicines, education, vaccines, and health screenings. What many don't know is that we're also present in many healthcare settings, almost everyone you can imagine, such as hospitals, clinics, long term care facilities, just to name a few. I decided to become a pharmacist after attending a forum that is very similar to the one that we are attending today. I knew soon after hearing a pharmacist speak that I had to explore this exciting profession of medication safety and patient education. To become a pharmacist takes a lot of hard work and grit. And you also have to attend pharmacy school, which is a 4-year program. To apply to pharmacy school, you have to complete math and science courses, which many schools, like the one I attended, refer to as pre-pharmacy courses. And that takes about 2 years to complete. If you're wondering what school I went to, it was Xavier University of Louisiana. After completing pharmacy school, you earn a Doctor of Pharmacy degree, which we abbreviate as PharmD. Once you complete your degree, you'll take clinical exams and a law exam in the state that you would like to practice in. These exams help to assure that you are ready to give the highest level of care that our patients deserve. I hope that we have some future pharmacists here today, and I thank you all for allowing me to share my journey. It has been an honor.
Okay. Hello, everyone. Can y'all hear me? Okay, good. So my name is Chelsea Henderson. I'm a PA student at UT Southwestern. This is my second year. So a lot of people don't know what a PA is, but a PA is a physician assistant, and they work in all areas of medicine. So that's the beauty of being a PA. So you can work in emergency medicine, family medicine, you can work in surgery, but there's a variety of other things that you can work in. So physician assistants practice medicine on teams with physicians, surgeons, and other healthcare workers. And it just depends on what area of medicine that you're in. That would depend on your role. But a generalized role is that they can examine, diagnose, treat patients, and perform minor procedures. So I chose this profession because I always had the desire to help people with their health. Originally, I wanted to be a dietitian, but my junior year of college, I realized I didn't want to solely focus on nutrition. So I ended up shadowing a PA, and it made me realize that I would be able to help treat patients with medications and procedures and not just nutrition. So that's when I fell in love with wanting to be a PA because I wanted to be able to use several ways to treat the patient and not just with nutrition, but I can always use my nutrition background. So there are several requirements of becoming a PA. But first off, you have to have an undergraduate degree in any area of medicine. So they usually recommend that you major in science, like a science major, so biology or biomedical science. But I majored in nutrition and I added a minor in biology. So it just depends on you, just as long as you meet those prerequisites. So it depends on the school, but it's usually like your basic biologies, chemistries, and there will be like a few math classes that you might have to take. Um, then you have to get into the PA school, and the PA school usually lasts 26 to 30 months. So you'll get a master's of physician studies, and then you have to pass your board certification exam. And so a day in the life of PA, so this depends on the area of medicine you work in, but I start clinicals at the end of this month. So I don't have that much insight on it, but when I worked in family medicine, basically the providers saw at least like 8 patients in the morning and 8 patients in the evening. And they worked from 8 to 5 Monday through Thursday, and then on Friday they'll work 8 to 12. Um, However, if you work in surgery, your schedule will vary. So you will help like prep the patient, and depending on what time the surgery is, you might have to be there 2 hours before. And also you will assist in like helping after the surgery. So if they have any incisions that need to be closed, then you would suture the patient up. But lastly, my main advice for people that are interested in becoming a PA is just to try to get as many experience opportunities as you can before coming to PA school, such as volunteering, working in the medical field, or shadowing a PA. It'll help you to appreciate the medical field even more and have a better understanding of the topics that you'll be learning in PA school. Thank you.
All right. Hello, all. My name is Travis Cook. I am a student physical therapist at the University of Texas Southwestern in the medical district. And I'm going to be talking to you guys about physical therapy, of course. So what a physical therapist is, we are just the movement experts in the health field. We do a lot of things with people with illnesses or injuries or disabilities and things like that. The good thing about physical therapy is you can work in a vast area of different fields or different aspects. We can work with, of course, people with injuries. Sport injuries is what a lot of people see us in. But we also work with, of course, traumatic brain injury patients, stroke patients, heart care patients, and things like that. So there's a plethora of things that you can do in physical therapy, and that's why one of the reasons that I love it so much. Like I said, we are the movement specialists, so a lot of things that we do are kind of prescribing exercises, doing a lot of hands-on care, and just kind of once we get the referral from doctors, kind of nursing people back into their regular function of life. It's a great field to get into because when you get patients, it's almost like a puzzle piece, and you can kind of figure out what's wrong with them, and we're the people that kind of get them back to what they love to do. So that's a beautiful thing about therapy. Going into why I chose this profession, I'm really a big people person. So with our patients, you really get to get into the communication aspect of the health field, where as we're working with patients for about a long time, a couple months. So we really get to know patients, get to know their lives, get to know everything they love to do. And we just try to get them back to that function and try to get them back to what they love to do. So it's a beautiful aspect of the job to really work with patients long term. And of course, you get to see them just grow into getting back to function. So that's a beautiful part of the job. Um, about physical therapy, the requirements to get into physical therapy. So of course you have to go into your undergrad degree. Um, it's recommended that you do a science degree. However, you're not required to go into a science degree as long as you get all of your prerequisites for the college that you want to attend or the um, graduate program that you want to attend. As long as you get all of those prerequisite courses, you're good to go for that class, and just do your research on that. Um, and furthermore, you just have to go into, once you're accepted into your graduate program, it's about 3.5 years. Some programs are shorter, some programs are longer. And yeah, you just kind of go into that aspect of the education field and get that done. And then it's a doctorate program. So you graduate as a doctorate of physical therapy. And then you get to sit for your boards. And once you pass your boards, you're ready to practice in the field. So going into the advice that I have for anyone that wants to go into physical therapy is just to realize that you're all capable. People have done it before you. It's definitely a rigorous coursework, but once you get into it and you're into the field, just remember why you're there, and just remember that you can always do it. So whatever you put your mind to, just keep on pushing.